Hi, I'm Dr. Erin here at the Lacey office of Thompson Healthcare, and today with the help of my son Gage, we're going to talk a little bit about cranial remodeling. Cranial work is really good for babies that have any type of like flatness or a bump on their head, but it can also be beneficial for babies that have other signs and symptoms as well too. Sometimes you'll see babies that have presentations where they have one squinty eye or a raised eyebrow, or they have a tilt to one side of their head, either side or forward and back. Babies that also have chronic ear infections or sinus infections can benefit from cranial work as well too. How this happens is most commonly through the birthing process. Babies are supposed to actually have their skulls shrink so they fit through, and then the baby's skull actually pops back out. It's called a blowout effect. Sometimes that doesn't happen for all babies, so we actually need to correct it. So in the case of Gage here, he actually has a little bit of a flat spot on the top of his head and a little bit of flat spot on the back side of his head as well. He does also have that squinty eye appearance. Sometimes you can see it, sometimes you can't. And today we're actually going to work on that. Not only is this technique beneficial for him, physically, so he has that nice round shape, but also it helps with brain development as well too, and neurological function. Some toddlers you'll see, or even kids you'll see, that'll have developmental delays or chronic headaches or sleeping disturbances because of this as well too. So to do this technique, we're actually going to apply a light pressure to the baby's skull. He sometimes tolerates it very well, other times is a little cranky about it, usually depends on his mood. So this is the technique to actually help with the cranial alignment. So what I'm going to do is place a gentle pressure on the sphenoid wings and as well as the mastoid. And I'm just going to do a little light pressure. Some babies tolerate it very well, other babies don't. Just really depends on their mood, but I'm really applying very, very gentle light pressure, just encouraging the movements of those cranial bones. Yeah. Good. So if you have any questions, please feel free to call the Lacey office and we can talk about some cranial work. Thank you. Bye.